Hi everyone, this is Veronica. Today we are going to talk about vaccine hesitancy. Like, what is this term and how does it impact our healthcare system? For queries and updates, you can connect with me on Instagram and Facebook because I feel together we can make a difference. Now, what is the relevance of this topic in your exam, in your mains paper too? It will be covered under health and education. At objective level, you should know what is measles vaccination in India. At subjective level, measles vaccine, the issue of vaccine hesitancy. Now, see in what context today we are studying this. First of all, you should know it is the most important topic because this will cover a key issue that came in the news for which students must pay attention, and this will also take care of certain key issues students have to cover in your various GS papers. Now the context is like there is a 30% increase in the measles cases worldwide. It has been noticed in 2018, and WHO, World Health Organization, they have included that vaccine hesitancy as one of the 10 threats to global health this year. So talking about vaccine hesitancy, what is it? So this is basically defined where people are reluctant and they refuse to vaccinate despite the availability of the vaccines, because sometimes there are many diseases where vaccines or any preventive measures are not available. But then there are diseases like measles and various others where vaccines are available. Even in polio's case, vaccines are available, but people are reluctant to take those vaccines, to get vaccinated. They refuse. So it only appears to have grown more dangerous to the public health. So in just this case, we can see the case of measles. So measles vaccine not only provides lifelong protection against virus, but it also reduces mortality from other childhood infections also. This is because measles viruses, they kill our immune cells. Immune cells, you should know, these are the bodyguards of our body. They protect us from any disease, any bacteria, any infection rather. So this measles virus kills these immune cells, leaving the child vulnerable to the infectious diseases for 2 to 3 years. So there is a surge in measles cases from WHO, African region, WHO, European region. And this infection spread in the European region has been unprecedented in recent years. And last month only in UK, Greece and Albania, they have lost their measles elimination status. Earlier they had the measles elimination status. That means there was no report of measles in those countries, but recently they have lost that status also. So talking about measles, so measles is a very contagious viral disease. It is transmitted via droplets from your nose, mouth or throat of infected person. There are some initial symptoms which usually appear 10 to 12 days after infection, which include you can get fever in this case, a runny nose, bloodshot eyes, tiny white spots inside the mouth, and several days later a rash develops starting on the face and upper neck, and gradually it spreads downwards. So it remains an important cause of death among young children globally despite the availability of a safe and effective vaccine. That is why we need to worry, because we already have a vaccine and people are still not taking it. That is vaccine hesitancy. Now talking about what are the probable reasons of vaccine hesitancy. So there is a report of 2018 on vaccine confidence among the European Union member states. They show that why vaccine coverage has not been increasing to offer protection even to those not vaccinated. So it is found that the younger people, age bracket is 18 to 34 years, and those with less education, remember younger people and people with less education, they are less likely to agree that the MMR, measles, mumps and rubella vaccine is safe. And only 52% of respondents from 28 European Union member states, they agree that vaccines are definitely effective. So there are 33% they felt they could be probably effective, and there are 48% respondents that those who believe that vaccine they actually cause serious side effects, and 38% think that actually cause the disease that they are supposed to protect against. So you can see this is a huge percentage. And even in India, in 2018, there's a study which found low awareness to be the main reason that why 45% of children missed different vaccination in 121 districts that have higher rates of unimmunized children, and they had apprehension about adverse effects, and they were reluctant to get immunized for reasons other than the fear of adverse effects. And in fact, these social media, Facebook, your Instagram, there you will find many posts which are playing a crucial role in spreading vaccine disinformation. So they are spreading wrong information regarding vaccine, and even your WhatsApp forwards also. So talking about whether vaccine hesitancy is real or fake, you should know this is one of the 10 threats to global health this year. So vaccine hesitancy, this reluctance, isn't real. Vaccination is one of the most cost-effective ways of avoiding disease. Currently, it prevents 2 to 3 million deaths a year, and a further 1.5 million could be avoided if global coverage of vaccinations improve. Measles, for example, has seen a 30%, as I told you, increase in some cases globally. In 2019, WHO will ramp up work to eliminate cervical cancer worldwide by increasing coverage of HPV vaccine, among other interventions. And WHO and partners are committed to supporting many countries to vaccinate every last child to eradicate this crippling disease for good. So feeding these concerns are unresolved controversies. So why we are seeing this reluctance? Because there are many unresolved controversies, like one involving polio vaccines and emergence of type 2 polio in Uttar Pradesh last year. The tragic incident in Hyderabad last week, where a child died and more than 20 others were reportedly hospitalized following treatment given vaccine after a vaccine was administered. And the doctors and the people who are responsible for this, who share the responsibility, they did not resolve these controversies regarding this thing that vaccine has caused that particular disease. So though there are many reports which suggest that death was not vaccine related, but it will add to the anxiety around a routine vaccination program. And vaccine hesitancy is listed by the World Health Organization, as I told you again and again, top 10 threats globally this year. And there's a sense of mistrust seems to underpin the growing concern being expressed about MMR vaccine in India. Outright anti-vax campaigns we are seeing even overseas. And however minimal or localized these incidents may be, health authorities are worried that it could negatively impact genuine public health and immunization campaigns. And against this backdrop, doctors and public health experts are calling for focused efforts to address parent and community fears with scientific evidence and tackle vaccine half-truths fanned by social media. For example, there is this mission Indradhanush in our country which has given a booster shot to universal immunization program. So the new MMR or you can say just MR vaccine, measles rubella vaccine component, with a targeted 410 million children from 9 months to 15 years is slated to be the next big leap after polio eradication in India. Now talking about what could be the way forward. See, there are many rumors in our country. For example, social media has actually played a role in spreading these fears and even panic. Vaccinators have been attacked in some districts like Malappuram in Kerala. There was even a rumor campaign that claimed that vaccination would make Muslim children infertile and that vaccines are pork-based. While it is right for parents to have a healthy skepticism, they should equip themselves with information. Rather, it is important not just for parents, for all the people who are watching this video right now, that you should equip yourself with information from the right sources. Now you have to decide what are the right sources. Facebook is not a right source. Instagram, anybody can post there. They are not the right sources. Right information from the right sources include your doctors. You should consult doctors. There are health health ministry representatives or authentic sources. Like you can go to the WHO website and not gather information from social media. Social media platforms, however, like Facebook and Google, now they have thought of steps to counter or block such or other misinformation. So for way forward, we could say work should be done to address misinformation. They are now committed to reduce distribution of such misinformation, and we need to empower our doctors also to project the value of vaccines and equip them to respond to concerns effectively and accurately, and they need to sensitize media to an evidence-based rather than sensational approach. So to conclude, we could just say that public health experts point to India's success in tackling polio through intensive immunization program. So the success of these programs lies in reacting quickly and honestly in case of vaccine related episodes and removing the apprehensions quickly. So this is what I suggest. Now in the comment box you can tell me what are the ways how we can improve our immunization programs and stop spreading the rumors around the vaccination programs. Thank you. So this is the channel StudyIQ. If you're preparing for UPSC or any government exam, our pen drive and tablet courses are available. If you're preparing for UPSC CSE 2020, our pen drive course is available where you can find 100% coverage of UPSC vast syllabus. Daily current affair updates will be available. Self-paced learning process is provided. This course has been prepared by top faculties of StudyIQ, and now you can purchase this course at Rs 625 per month only. For additional information, you can visit our site, and there are the phone numbers also given. You can call them and gain the additional information. You can connect with me for my video updates on Instagram and Facebook, because I feel together we can make a huge difference. For queries, you can even email me. Thank you so much.